Welcome everybody today to our seminar on improved outcomes treating epitheliomas, eyelid tumors, and skin tags with cryosurgery. Our clinician is Dr. Mark Hanlon. I'll introduce him in a moment, but a few housekeeping items I want to take care of. First of all, I want to encourage everybody to view or send in questions you may have after viewing the webinar. We'll be sure to follow up with them. Also, you'll be getting a link to the webinar that you can share or view again in the future, and a general treatment guide that will follow along. Now let me introduce Dr. Mark Hanlon. Dr. Hanlon is a graduate of Eastern University with an undergraduate degree in chemistry, a man after my own heart, having pursued the same profession. But after working in industry for a number of years, he decided to pursue his dream, which was to become a veterinarian. So in 1993, graduating magna cum laude from the University of Pennsylvania School of Veterinary Medicine, he then started his career as a veterinarian. And following graduation, he also started his own business in Gilbertsville Veterinary Hospital, and that was in 2003. So besides his love of veterinary medicine, he also does outside work with his family. He competes in triathlons and adventure races. Hopefully he's still doing that these days. So we welcome him to the seminar today and his experience using cryosurgery. So welcome, Dr. Hanlon.
Thank you.
So the way this will work is I'm going to just pose some questions, and so feel free to talk to your colleagues about your experiences using cryosurgery. And so let's start kind of at a high level here. So skin lesions, they're common to us as humans, and certainly our pets, our companion animals, as they age. And of course, with certain breeds, it seems to start from a young age. So before you started using cryosurgery, what were you doing to address these kinds of lesions with your patients?
Yeah, it's a great question, and it was really frustrating. It was frustrating to me because clients would see him in an exam and they'd say, Rover has this little lump here, and most of them were cosmetic. The dogs didn't spend a lot of time looking in the mirror going, oh, that's so ugly. They didn't care about it, but it certainly bothered the owner. And I felt like I didn't have any good options. It was either let's take them to surgery, general surgery, which involved general anesthesia and everything that goes with that, or do nothing. And there was a big gap there. And earlier in my career, I had some people ask, hey, maybe you could, put a local block in there and try it awake. And I was like, young and naive at the time. And I was like, what's the worst that could happen? Well, the worst. It was, you don't want to get in a point where you have 3 technicians holding a dog down with a local block. So that quickly went by the wayside. And so there was a big gap there that it was either do nothing or wait maybe a year or 2 or until the dog had a dentistry and it was an add-on surgery. And then with the surgery, it was a relatively minor surgery, but it's still surgery. You're still putting sutures in there, and some of them would dehiss, and you'd have to worry about secondary infections. And it was very frustrating. I felt it didn't provide great client service or even best medicine for those patients. So very frustrating over the years, no doubt.
Right, and I know we're going to talk about the use of nitrous oxide today in your practice and your experiences. Had you used any other types of cryosurgery previously?
I had not. I certainly investigated it, and there was the traditional liquid nitrogen, which seemed a big investment and a learning curve on that. And that was certainly had been described in the past for certain types of tumors. There had been some cryosurgery handheld pen units that at the time perhaps did not get good reviews, so that didn't seem like an option. And again, it was frustrating because it's so common in human dermatology. My brother-in-law is a dermatologist and he freezes everything, and I'm like, man, it'd be great to have that. It seems like the magical solution, but at that time, at least I wasn't aware of any products out there that really filled that niche in the market.
Right. Right. No, that's great background for everybody. And are there certain breeds or stages in an animal's life you're tending to treat more often than not?
Yeah, I think breed wise, I think Cocker Spaniels tend to have a million lumps, God bless them. But generally, it's the more mature patient perhaps that would grow these lumps and acquire them over the years. And with my clients, I tend to call them wisdom bumps. They,
Hmm.
it's more the wise dogs, and it's funny. Clients basically are at the point where a lot of them just accept that their dog's going to be lumpy and bumpy, and it's also a concern for the dogs that need to be groomed because the groomers a lot of times will nip them, and it's not great client service between the groomer and their client. So it's again a real niche in the market that needed a solution.
Yeah, no, and again, we're just trying to frame it up at a high level, why you
Mhm.
considered this and what you did
Yeah.
previously. So it sounds like it fit this niche between, sort of going all the way over to surgery or doing
Hmm.
nothing at all. And
Hmm.
so, for the sake of the owner, for the sake of the patient, this seems like a happy place. Why don't we look at an example now?
Sure.
Let's look at eyelid tumors. We have
Yeah.
these are still photos. And if
Mhm.
we could, why don't you narrate through sort of the whole treatment sequence here?
Sure. Yeah. So, obviously here's a dog with an eyelid tumor, primary meibomian gland adenoma. And again, the dog doesn't spend a lot of time looking in the mirror and putting foundation on it or covering up. They tend not to care about these, but particularly this case, it's a black dog with you can see the pink pigment there. And that's it's right where you look at your pet. You're looking in the eye every day, and it's really troublesome. That would bother me with my pets if they had one of these. And certainly, if this mass continued to grow, which most of them do over time, um, it can start to affect the patient. They start to get a lot of discharge in the eye. And I use the analogy, it's like having a leaf caught under a windshield wiper, and it just doesn't clear the eye well enough. So you get a lot of irritation and things like that. And again, here's a perfect example. What's the ultimate solution? It used to be surgery, a relatively simple surgery, but again, involves sutures and things like that. Here's a picture of using the cryo unit. Again, you want to use some protection from the cornea because there's a little spray of ice crystals there. But with cryosurgery and a simple application of nitrous oxide, you can actually freeze that mass and get it to fall out in an awake patient. Here's a picture of it with the ice crystals showing that it's got a good freeze. Um, Certainly
So
there's a, yeah, I'm
if I
sorry.
can ask, how long might you freeze or how many times might you freeze something like this in a visit?
Yeah, I generally try the kind of the gold standard is 3 freeze thaw cycles. And you want to make sure you get a good freeze, but you also want to make sure you get a good thaw. So, which isn't a lot of time in between, but you need to have a little patience with that. Um, and so generally it's 3 to maybe 4. Um,
Hmm.
Here's a resolution shot afterwards. You can see that the mass is gone. There's a little depigmentation on the eyelid that will probably fill in later. But this is probably 2 to 3 weeks later. And certainly no sutures, no irritation in that eye. And it's great resolution from that mass that was on that eyelid. So.
Hmm. And any post-treatment instructions for the owner?
Yeah, basically, so you want to set up proper expectations. And I normally tell them the mass will probably reach its ultimate resolution in 2 to 3 weeks. I really expect a week or two, but I like to under promise and over deliver. So, but for the first few days, it's certainly going to be red. You are going to make that tumor, that growth a little angry, and that's the point of it as it's dying off. Tends to be very minimal irritation to the pets. I've had experienced very little irritation or scratching at it or anything like that. Certainly far less concern than with surgery. I don't think I've ever used an Elizabethan collar or anything like that. So probably wouldn't even use eye drops or eye ointment to ward off treatment. Maybe in the exceptional case, but it's very minimal aftercare.
Right. So no need to use a cone then after.
Nope.
And do you usually, is it one treatment or do you need more than one treatment?
Yeah, that's a great question. It depends on how big the mass is when you're starting, and particularly eyelid tumors. They're kind of a different than general dermal masses because a lot of the eyelid tumors have a base back into the eyelid, and you can't always get that full base of it like you can with surgery. Um, but a lot of the ones I treat are starting to become ulcerated or the pets are rubbing at it. And so the first step is to knock it back and make it smaller. And that's virtually 100% successful in doing that. And I'll tell the client that I said, we may not completely resolve all of the mass, but we can knock it back, see how the patient does with it, maybe do a second or third treatment if necessary to get to complete resolution if we need to do that.
Mhm.
So
Yeah,
that tends to be the exception, other than
yeah.
the dermal masses. Yeah,
Setting expectations is clearly one of the key things. So that's good. That
absolutely.
was a great example with
Hmm.
an eyelid growth. Let's look at another one here, which is
Okay.
more of a tag growth, if we can bring that one up.
So here's application. This is looks like another eyelid growth here, and again, you're protecting the cornea from the ice crystals that may spray out to keep the patient comfortable. You apply the nitrous oxide. Um, you're waiting for it to thaw here. Doing another application. You can see the ice crystals there as it's freezing. The patient basically is not responding at all. And again, you're trying to get the base of the tumor as much as you can. So, and then you'd wait probably 3 to 4 treatments on that. And honestly, that takes maybe 2 to 3 minutes at most, maybe 4. So it's very minimal time consumption on that.
Good. And so now when you move, sort of out of an eyelid tumor into something that's more like a tag somewhere else
Mhm.
on the patient, are there differences in the way you might treat that?
It's probably easier to treat that. You don't necessarily need as much protection from the ice crystals and things like that. So
Mhm.
um, it's basically no clipping, no scrubbing, none of the stuff you do for surgery. You basically move the fur away, assess the mass. If there's a crust on there, you obviously want to get the crust off. If there's a little bit of hemorrhage, you want to dry it so it doesn't dilute that temperature drop, that freezing process. Um, and it again goes back to depends on how big of a mass you're trying to take off. If it's up to maybe 3 or 4 or 5 millimeters, you just kind of zap it with the cryosurgery. Again, 3 cycles, freeze thaw. If it's a little bit bigger, you want to basically do 2 halves or quarter it, and then you can just work your way around. You do a freeze, move to the next section, do a freeze, move to the next section, freeze it. By that time, the first one's thawed, and you just move your way around and you just get in a flow. But
Mhm.
again, minimal preparation, no clipping, no scrubbing, very simple.
Yeah, you're touching on something here, and we talked about your brother-in-law who uses
Yeah,
liquid nitrogen. You
yeah.
think about it, if you treated us with liquid nitrogen or nitrous oxide for more than, say, 5 or 10 seconds, we'd be blistering. But it
Hmm.
sounds like because of the physiology of animals, you're able to treat for extended periods. And do you produce a blister or anything when you treat with cryo?
I've never had that. No, certainly it's a little bit red. It looks more irritated than what the patient perceives from what I've heard from the clients and my own dog. I've done my own dog, and just about everybody in the clinic has seen how effective it is and used it on their patients when appropriate. So certainly no blistering and really minimal reaction from our patients.
Yeah, so it makes sense. I mean,
Mhm.
it seems to be a winner for the patient, easy for you to use. Now, if we can, let's segue over then to the practice because you have quite a few on your staff.
Mhm.
Is everybody using cryo right now?
Oh, absolutely. Yeah, no, it's
Great.
yeah, when we brought it in, we're like, we're going to use this. This isn't going to be, for just for Doc Hanlon or anything like that, his little
Right.
toy. And plus it sells itself and it fits our paradigm. The major philosophy of our practice for any decision really is what we call our three pillars: best medicine, best business practice, best client service. And any decision is filtered through those three things. And cryosurgery certainly fit. And when we had the demonstration and then brought it in, I think it's exceptional client service. The clients just were like, yeah, sure, let's do it, because they've had stuff done or heard of stuff done on them. And they're kind of surprised that it's an emergent therapy in these days. But they loved it. It's certainly best medicine. You're saving that patient from general anesthesia, and you're able to address these skin growths and eyelid growths in an effective way. And the business aspect is it's been surprisingly well accepted, and it's done quite well as a revenue center also.
Yeah, that was what I was going to ask you, and you just nailed it on the
Yeah,
head. I mean, if it's just another procedure and it doesn't really add more value back into the business, then it may be
right.
best practice and you go for that reason. But if you can hit on all those pillars, that's awesome.
Absolutely. I knew it would be best medicine, and I was hoping that the clients would accept it and that it would, be a good revenue center, so we'd get to keep it, and it was.
Mhm.
So
Awesome.
everybody was happy. It was good. So
Yeah, that's good.
absolutely.
Okay. So then
Yeah.
let's start to wrap up here at this point, because I think we've touched on just about everything that I've had on sort of my outline here to cover with you today.
Okay.
Now, again, our philosophy in creating these is to really talk with you as a clinician and for you to share with your colleagues your experience, because I would agree, cryosurgery in veterinary medicine has been somewhat limited, probably because the time was not taken to really distinguish what is the best practice for companion animals or equine compared to, say, humans, where it's much more common.
Hmm.
And you nailed it today. You have to treat longer. You have to be aggressive. You
Hmm.
don't create a wound when you do that, and it's comfortable for the patient, and it's familiar to the pet owner,
Hmm.
which,
Yep.
and the big one is it also helps the revenue of the practice to the positive side, not just dilution,
Right.
but additional revenue, which is great. Now,
Yep.
the last thing we'll talk about is the product you've been using, of course, is the
Hmm.
CryoLab. And
Yeah.
this again, we're not going to go into the details of the product overall, but it uses nitrous oxide, obviously.
Hmm.
But if you could just comment on, for you, the usability or what you've seen as the strengths or even a weakness of that
Yeah.
platform for you.
Yeah, it's been great. It's a small unit, certainly portable. When we first started using it, we would have patients come in for the day, much like our other surgical patients, do the procedure and then discharge them. We quickly realized that we don't need to do that. And I've even taken the cryovet into the exam room and performed cryosurgery in the exam room in front of the client, and they're amazed that the pet's like, whatever, I'm eating treats here, they don't care. So
Mhm.
I think the portability is very important. It doesn't take up space or anything like that. It's very easy to use. I'd say idiot proof just about, and I put it through its paces. So that proves it's pretty much idiot proof. So if I can run it, anybody can run it. I've changed
Mhm.
tanks and everything. And the controls are very easy. You basically turn it on. It's got a wonderful light that lets you see what you're doing. You have two options for time: 5 seconds, 10 seconds. I'd say 99% of the time we run it for a 10-second cycle, and that's certainly good enough.
Mhm.
It lets you know how much nitrous oxide you have, so you don't run out mid-procedure. So um, I think the portability, the reliability, the fact that it doesn't take up much space, I think it's a good price point for what it does. It's
Mhm.
certainly paid for itself, more than paid for itself, and we've had it for less than a year. So um, I think nitrous oxide is a great vehicle that it really threads the needle, that it takes care of the growth and the tumor without causing discomfort to the patient. So yeah, we're just thrilled with it. It's just integrated into our practice seamlessly. So, I'd encourage people, if you have any interest whatsoever, check it out, get a demo. We brought in 3 or 4 patients. I talked to some good clients and said, hey, we're going to try this cryo unit. I'm not sure about it. Let me borrow, Chloe and Rover and borrow for a day. And a week later, every single one of them was like, hey, that thing fell off. And it was great. And other clients heard about it. And so once we ordered it, we put something on our website that cryosurgery is going to be available at our practice. And I had a waiting list of about 20 or 30 clients that couldn't wait till we got it. So it's really, I think it will fill that niche between going all in with general surgery or just waiting. And it's going to provide a great tool for you to use. The practice managers will be happy because it pays for itself. As far as price point, we priced it on a per unit basis, and a unit is about 2 millimeters. So a bigger mass would be maybe 8 units. A small one would be 2 units. And it's a great, I mean, clients just go, yeah, it's great. It's cheaper than general surgery without the safety concerns. So if you're, smart about pricing it right, you won't have any flashback from clients. They'll just be thrilled with it.
Well, thank you. Thank you very much. So again, for everybody out there, hopefully you've enjoyed the conversation with Dr. Hanlon, and this is, whether you use this CryoLab or something else, gives you some insight into how to perform cryosurgery best in the veterinary practice. And again, we're all about best practices to start with. As I said before we began, our philosophy is if you do things right and you really study the best approach, it'll all fall out underneath what's the best product for you. Now, we're really happy, of course, CryoLab is working for you. So again, thanks for sharing it with the viewers. I want to remind everybody that we'll be sending out a link to the webinar if you've been watching, and a general protocol guide. And if you do have questions, send them in, post recording, we'll get you answers to those. And again, Dr. Hanlon, thanks so much for your time today.
Thanks for having me. I enjoyed it. Thank you.
Okay. Thank you again, everybody.